And as I read the article, I was very interested in this company. I never heard of the company. I didn't know anything about the technology. It's a South African company. And being somebody who's very interested in use of biostimulation, use of various electrical stimulation, light stimulation products in my practice and seeing their potential benefit, I was very intrigued. So I reached out to the company, and I was, as I have with many companies, and I was very interested and really surprised by how quickly they were in responding back and sending me research, including some of the areas that they have recently completed, which I hope you'll hear more about in the neuropathic pain space. So I was interested about the science that they have, as well as the level of evidence they brought to get FDA clearance. So with that as a background, what you're seeing here today is something that just developed over the last 2 to 3 months. And it's something that we would like our members, when you hear about new technologies that you think are the real deal, we want to hear about it. We want to connect with those companies. We want to vet them and make sure it is something pertinent for the larger audience. And we really believe that is the case here today. So with that as background, I want to introduce the company and their CEO, Corlius Burkill. He is the CEO of Xavant Technologies, which is from South Africa. He has an MBA and an honors degree in biomedical engineering, and he has been with the company because they are in the disruptive space of treating pain. They have been at this since 2003. They work typically outside the US with interventional pain specialists looking at ways to locate nerves using their patented technologies. Over the last few years, they've been able to use that same technology to develop not only a diagnostic tool, but a treatment tool, which you'll hear about in the Stimpod, which is able to locate specifically where you should treat specific neuropathic conditions as well as chronic intractable pain syndromes. So I'm very intrigued to learn more about the science here today. We're very fortunate that their CEO is here from South Africa to tell us more about the technology. And beyond this, in the exhibit hall, you can learn more about it at their booth, number 221, I believe, Xavant Technologies. So without further ado, Dr. Burkill, thank you.
It's a privilege to be here. I just flew in from South Africa 2 days ago, and very eagerly, besides the invitation, a trip to San Diego is never wasted. It's one of my favorite places in the world, so thank you very much for that.
There was a big period of my life where I was in chronic pain and went to my doctor time and time again. Just wasn't taken seriously at all.
I was having a ton of pain, even though I was on a shit ton of morphine. And I told the doctor this, and he said, oh, let's up the dosage of morphine, and you just got out of surgery, there's gonna be pain.
Even when we were paying top dollar to see specialists who you would assume would give you more time and more care, it was like $250, $300 to see this person for 5 minutes, and they said very similar things.
One emotion I remember feeling the most is just shame and embarrassment. I felt stupid for going to the hospital both times. I felt like I was being a crybaby, and I felt like I was imagining the pain that I had gone through.
Why wouldn't you want attention when you're in pain? Like, why do we make ourselves feel bad that we want someone to listen to us?
It was the most infuriating thing, and it honestly is like 5 years of my life that I see as missing.
So I'm sure these type of patients are very familiar to all of you here. In fact, I think that's what's brought us all together here. Some of you, as healthcare practitioners, may actually be these patients. So I must say it's the first time attending a pain meeting in the US. And I really appreciate the invitation that Dr. Benaktor extended to me. I'm exceptionally thrilled by the integrative approach of this meeting. I think it's absolutely necessary in this space. I think chronic pain is one of the things that we really struggle with to treat effectively at this point in time. And we need to approach it from as many different viewpoints as possible if we're going to be successful in treating it. It really is a global epidemic. You know, the statistics say that about a third of the global population suffers from chronic pain. It's astounding. It's astounding. It's a global epidemic, really. Something that unfortunately, I personally feel that the standard of care that we have to offer today just does not address it sufficiently. I mean, we've got pharmaceuticals in the pharmaceutical space. The anti-inflammatories and opioids, I know, got quite a bit of bad press recently in the States. We have interventions, surgical, non-surgical interventions, specifically probably most often used is radio frequency ablation. Neuromodulation, we're talking about TENS. TENS has got limited efficacy for reasons we'll explore a little later. Spinal cord stimulators are nice, and for the right indications they do work. The problem with pharmaceuticals, I believe that pharmaceuticals are fundamentally challenged in the way that they approach the problem of chronic pain. The reason for that is, if you look at something like neuropathic pain, for instance, we're dealing with an individual neuron or nerve bundle that suffers, the characteristics of which have changed, and now they're neuropathic. That's a sick nerve. And we try to deal with a sick nerve through pharmaceuticals in a way that we're either trying to stop the neural transmission through the synapses by trying to mimic the neurotransmitters or blocking the receptors, or as in the case of anticonvulsive medicine, we try to suppress the neural membranes as a whole to stop the efficacy of that specific nerve. Unfortunately, obviously, drugs are introduced to the whole system. And when we try to suppress one single nerve, we actually suppress the entire nervous system, and thus the side effects. So it's fundamentally challenged as an approach. When we look at surgical interventions, or let's talk about probably RF nerve ablation, the nice thing about that is that it's more targeted. All right, so we're not affecting the whole system. However, it's a surgical procedure. So all the risks that we have accompanying surgical procedures, the anesthetic, the potential for infection, all of that are risks that go along with it. In some instances, the nerve ablation and the scarring associated with it may actually cause neuropathic pain. And when the procedure goes wrong, we end up with paralysis. And lastly, it's an expensive procedure, so it's not something that unfortunately can be repeated very often. When we look at neuromodulation, when it comes to chronic pain, that's also a problem. Both TENS and spinal cord stimulators work on the premise of the gate control theory. So we are trying to stimulate and overstimulate sensory touch nerves, and through an interneuron connecting to the A delta and C fibers, we're trying to suppress the pain. Right? The problem with chronic pain diseased states is that in many of these states, that interneuron has been destroyed. It doesn't exist anymore. So that gate control mechanism doesn't exist anymore. In even worse cases, these interneurons actually become excitatory rather than inhibitory. So in some instances, TENS can, for instance, actually aggravate the situation, make it worse. Spinal cord stimulators, when the indications are correct, very effective. We, again, dealing with the kind of problems that we deal with when we face with surgery. So potential for infection, risk associated with anesthesia, etc., etc. And above everything, it's expensive. It's a very expensive procedure, relatively speaking. The one thing that all of these standard of care treatments have in common is that we're treating the symptoms and we're not treating the cause. Now, symptoms, obviously, treatment of that is temporary. When you associate it with high cost, when you associate it with lots of iterations of different drugs, etc., you can understand the frustration of these patients. And more so, I can understand the frustration that I've seen in dealing with so many pain specialists. I understand the frustration that you feel when you just can't help your patients sufficiently. And I'm sure many of you must have felt like this at some point in your career. In the March 2015 edition of Scientific American, there's a neurosurgeon by the name of Dr. Kevin Tracy. In that publication, he proposed that nerve stimulation can be used to precisely target the biological processes underlying the disease. Obviously, if we're able to achieve this, he recognizes that we'll be able to develop more effective and safer treatments. They'll be cheaper as well, less side effects, in many cases no side effects. And I think, intuitively, if we think about that, this is going to make sense. I mean, we just spoke about the drug model. So with drugs, we're trying to affect the neurohumoral system by introducing things that look like the neurotransmitters of the pathways that we want to affect. So we either replace it, introduce it with a drug, we modulate the synaptic transmission to neurotransmitters, or as I said previously, we try to suppress the cell membranes themselves so that they are less prone to, or less efficiently create action potentials with the nerves. But through nerve stimulation and introducing electromagnetic fields, we can actually stimulate a single nerve and cause it to release those neurotransmitters naturally. The nice thing about that is that it's targeted. So, in principle, if we study the nervous system and the effect of the electromagnetic fields on the nervous system well enough, we should be able to completely modulate the neurohumoral system in the body just through the application of electromagnetic fields. This is a main interest of Xavant technology, and this is what we focus our research and our development on. The vision of Xavant technology is that we want to create electromagnetic cures that target the biological root cause of the disease states, increasing treatment efficacy, and most importantly, whilst eliminating side effects. Now, I know this may sound like a little bit of a fairy tale at this point in time, maybe quite idealistic, but in the face of this, I mean, 289 million opioid prescriptions per year in the USA in 2016. That's a lot of drugs. And, you know, the 33,000 deaths that were associated with that in 2015, I think is easier to understand when we look at the bigger problem. So, I actually heard another interesting statistics a little earlier in this meeting relating to anti-inflammatories, and I believe that causes about 60,000 deaths due to hemorrhaging every year in the States. That's quite shocking to me. You know, if there's even the slightest chance that we could come up with a cure that can precisely target the biological processes of the underlying disease, which is targeted, that treats the cause, and has limited or no side effects, I think we are compelled to have to explore that and research that as a possible alternative, for sure. When we look at one of the most difficult areas of chronic pain to treat, I believe that would be neuropathies or neuropathic pain, we see that about 4% of the population in the US suffers from it. That's very significant, you know, and that's really disconcerting as well, because I think, as you all agree, that we just don't have magnificent answers for neuropathic pain specifically. If we break it down a little further, we'll see that the second highest performer on neuropathic pain is diabetic peripheral neuropathies. Now, if we look at one of the drugs that was specifically designed to treat diabetic neuropathies, this is a Lyrica that you're all intimately familiar with, I'm quite sure. Now, if we look at the numbers needed to treat, to show some benefit to a patient, so the numbers needed to treat for Lyrica is 5. That means that 1 in 5 patients might show will show some benefit. It doesn't mean it's going to take the pain away 100%. It just means that they're going to show some benefit. Now, obviously, that helps. If we can help 20% of the population, great. But when we look at the numbers needed to harm for Lyrica, that's 1 in 1. That means 100% of the people that get prescribed Lyrica is going to suffer harmful effects of it. But this is disconcerting. This is very disconcerting. So we're harming 100% of the population to try and benefit, to some extent, 20% of the population. And we're happy to do that. I mean, 289 million prescriptions of opioids per year. So let's look at what the harm that Lyrica does looks like. And the most common side effects, we're looking at dementia, headaches, blurred vision, double vision, burning, tingling, numbness of pain. Those are all symptoms of neuropathic pain that we're trying to treat in the first place. Less common side effects, anxiety, eye disorders. That just doesn't look like fun to me. When I looked at this and I tried to look at it objectively, the first thought that came up to me is that, I really can understand the frustration of the patients that get prescribed these drugs. And secondly, looking at that, I'm like, as humanity as a whole, we're so technologically advanced in so many different areas. Is that really the best that we can come up with for a problem such as neuropathic pain? To put it in perspective, I mean, a little more than 300 years ago, not such a long time ago, we had absolutely no clue what electricity was. We could see the effect of it, lightning, the effects of the phenomena of static electricity. That was in the domain of the gods. I mean, we literally didn't understand what that was. 300 years later, and we are absolute masters in manipulating the tiniest little electrical charges. We can manipulate it with such precision and at the speed of light, to the extent that today, each one of you are carrying the equivalent of a supercomputer of 30 years ago in your pockets in the way of your cell phone. It's a phenomenal thing. So we've gone from nothing to cell phones. We can communicate with electromagnetic fields all the way to Mars and precisely get information from Mars. I mean, even control a little buggy on Mars from Earth. That's how well we've got this thing down. That's significant mastery over electromagnetism. Now, to put it in perspective, in 1791, Luigi Galvani, I think it was 1791, did his first publication on bioelectromagnetism. That's 230 years ago. And I think, sadly, today, our understanding of bioelectromagnetism is not really much further than what it was when Luigi Galvani first published his understanding of it. And in the face of a related field that we've advanced so much, but when in the context of the body we have so little understanding, to me, I don't understand the discrepancy. And I think it's extremely important, and I think this area of research, this field of research, definitely warrants a lot more attention. I personally feel that it's the next frontier in medicine. It's something that we've neglected. I think we could have been further. So, anyway, I digress. I get a little passionate about the subject. What if we could do this for diabetic neuropathies? So, this was a study that was done on a predecessor of our current device that we're marketing and that we have at our booth. It's a study that was done at St. Thomas's Pain Clinic probably about 8 years ago already. It's a pilot study. It was done by a very well-recognized and respected pain physician, Dr. Theodore Groznik, in the UK. It was done on 34 patients suffering from diabetic neuropathy. They were all intractable. So we've tried everything. Well, they've tried everything to help these patients. Nothing worked. So they were treated with our device, 3 treatments of 5 minutes each. And these were the results. 60% of the people got 100% pain relief after that. And the other 40%, anything from 90% to the least ones, the last 3 people had a little more, less than 25% improvement. That's 100% efficacy. And 0 side effects. If we look at it in drug terms, it looks like this. So, numbers needed to treat, 1. 100% of the people benefited. If you look at the numbers needed to harm, that's infinite. There's no side effect. There's nothing that can harm people with this treatment. Now, granted, this was a pilot study. We are actually currently doing a formal study at an academic institution in South Africa called Wits University. We're about 2/3 through the study, and initial results are very similar to these staggering results. So, please, if you're going to follow us, please have a look out for that. You'll see the studies, or the official results of the study. So, we did not only treat diabetic neuropathies or neuropathic pain, for that matter. We've seen a massive effect also on sensory neuropathies or palsies. So, this poor lady at the bottom left, she got introduced to our technology a couple of years ago. She suffered from an intractable couple of attacks over several years of Bell's palsy, and at the time that we got her, I think she hadn't had any treatment for about a year. A neurologist just told her to make peace with it because there's nothing else that's going to work for her. Well, this poor lady, she worked at a nursery school, and she had to quit her job because she was scaring the kids with her facial expressions, or the lack of it. She came to us, we treated her 5 to 15-minute treatments every day for 6 weeks, and that's the result we got. We got a similar result with that gentleman. He was also intractable. There's nothing to do for him. So, what's nice about our technology, and that we're very excited about, it doesn't work for everything, like any other technology. But the types of things that it works for are things that a conventional medicine just doesn't have a good answer for. And, you know, when we treat those people and we get success, it's such an emotive thing. It's so people get so emotional. Many of those people are suicidal, totally depressed, and we get people driving out to our offices in tears and just thanking us because of the difference that we were able to make. And I'm sure you also have similar stories to tell, but that's a feel-good technology. So I have a couple of more testimonials that I'd like you to have a look at. It. Just a couple of conditions. If you want to see more and more evidence, please visit our website.
For over 20 years, I was unable to close my fists more than that.
Perhaps I should say to get out of bed in the morning is excruciating. My husband witnessed me standing at the end of my bed and wanting to cry.
The kind of pain was so bad that the day before the op I couldn't even work the remote control on the TV.
It was unbelievable. No sleep at night. Couldn't cover the feet because anything that touched them irritated them.
And it's now 4 months later, I would say, that since I did it, and they're both still working well. So it's really worked for me and doesn't appear to need any follow-up treatment. And I can even do this, although you probably won't hear it because it's electric and it's not connected.
What was going to be an operation 5 months ago, I'm nowhere near that now.
And interestingly, the elbow that I didn't have the op on probably healed quicker and better than the one I did have the op on. And what it means is I don't have to have the op on that arm. So I think as a kind of vindication of the treatment that was applied, it does show that it definitely had some impact.
You know, having my feet back and being able to walk is just the biggest pleasure that I could ever have. And I'm very, very grateful.
So I'm sure the next question on everybody's mind is, well, what does it do? How does it work, right? So the first thing I'd like to tell you is that the basic therapeutic technology that it's based on is not new. So the pulse radio frequency energy, research has been done on it for several years. As you see there, in 1975, there's a publication done by Wilson et al. And they use pulse radio frequency using an antenna, and they actually irradiated the subjects, which in this case were poor rats whose peripheral nerves were severed. So they transmitted this from outside the body, possibly, obviously affecting the whole area. But they saw tremendous results and a significantly sped up reaction for the rats that were irradiated with pulse radio frequency energy compared to the control group. I mean, that was there already a long time ago, 40 years ago. In the one thing that came out of thermal nerve ablation in the late 90s, a person that was using it, a doctor, did a publication and he changed the indication slightly. So he said, well, there's some risk going along with causing the scars that go along with thermal ablation. Let's just heat it up. So let's not cross that crucial 43 degrees Celsius for an extended period of time, so that we don't actually cause necrosis. And let's see what happens. I'm not sure what motivated him, but they started seeing good results with that. In isolated cases, I know pulse radio frequency in the US using RF generators is somewhat controversial. But in 2002, an official study was done by Gucci and his colleagues, and they realized that, you know, when this is applied, and if you just think about it for a moment, it's very similar to the previous scenario, but now the tip of the needle actually becomes your antenna, and you start transmitting this electromagnetic field very close to the dorsal root ganglia. And they recognized that there was some metabolic activity as a result of it. So the early gene CFOS, which shows gene expression changing in the mitochondria, is what they observed. This was confirmed in 2006 by Hanan and his colleagues, also seeing a lot of metabolic activity after pulse radio frequency, even up to 14 days after application. Interestingly, also they saw that it actually, the radiation actually targets the small diameter A delta and C fibers, the pain fibers. So it seems to be reasonably selective in its application. They also confirmed that the effect was not on the processes of the nerve, but actually on the cell body. So what we do is not really new. How we apply it is new. It's important to understand that, you know, when you apply pulse radio frequency, then it triggers a change in the gene expression, and effectively it changes the programming of the nerve. So just like the programming changes of the nerve when it becomes diseased originally due to neuroplasticity, exposing it to pain for a very long time, the nervous system responds and it tries to become more efficient, and it starts creating pain when it's not supposed to have pain. That's the programming of the nerve that has changed. Now, it seems that with pulse radio frequency energy, when it gets applied, it actually remodels this. It changes the gene expression and in fact resets it back to zero, or to its original state. So pulse radio frequency in that respect is recognized as a neuro-remodeling technique based on neuromodulation. Now, our innovation lies in the following. We were granted a US patent for this a couple of years ago. Now, the problem with pulse radio frequency is that you don't actually have a sensation. If you get it at a sufficient intensity, it will heat up the tissue, just like a microwave. Right? But you don't really feel it. Now, we argued, you know, on the one side, you've got pulse radio frequency that can be transmitted with an antenna to the entire body and have an effect on the gene expression in the nerves and actually kickstarts the regeneration process. On the other side, you've got an antenna that can be introduced invasively and close to the dorsal root ganglion, also acting as an antenna and changing the metabolic processes. We argue that because it's an electromagnetic wave, and because of the semiconducting properties of nerves, we are actually able to apply this non-invasively, peripherally, superficially on the skin. If, and there's a big if, the specific offending nerve can be reached transcutaneously. So if we can get close enough to it, but a lot of the peripheral nerves we can actually get very close to. So we've developed this device with a probe with which we can very selectively get to that nerve, but the problem is you don't know if you're on the nerve. So we combine this with our nerve location technology, and if you go onto our website, you'll see that we've actually been in the nerve location and NMT monitoring business long before we started with this therapeutic business. So we combine it with a square wave that we use in nerve location, and this will actually cause a contraction of the associated muscle of the nerve. So when you locate the nerve, you can now monitor it. Like for instance, the brachial plexus. If you go to if you go to the brachial plexus, you expect to see a contraction of the biceps. All right. If you go a little forward, you'll get the phrenic nerve, and you'll get your diaphragm contracting. If you go to posteriorly, you'll get the posterior deltoids contracting. So this gives you a way to actually very accurately determine and get to the nerve that you want to treat. Along with that, we designed the waveform such that it's got extremely high rise times, so the onset of the pulse is very quick. What this does is it actually shocks the nerve a little bit. Well, the whole thing shocks the nerve. It feels, the sensation of it is uncomfortable. If it's a gradual onset, the nerve accommodates and it's a comfortable sensation. If it's extremely sharp, it's uncomfortable. It's a prickly feeling. Now, the interesting thing that we saw with that is when you apply it to a normal nerve, it's uncomfortable. When you apply it to the nerve suffering from a neuropathic condition, it's actually very comfortable. You can increase the current, and the patient will just ask you to keep it there because it's just relieving and very comfortable to a nerve suffering from a neuropathy. So with that, we designed a waveform that actually assists you with diagnosis as well. So you need to understand, as a healthcare practitioner, you need to understand your nervous system very well. You need to understand pain and the different components of it, and to be able to distinguish between neuropathic pain. And you need to know where to target it, but we help you in a way to assess exactly whether what you are treating is the right thing. Besides that, we also have the ability to increase, obviously, the intensity of the stimulation and decrease it. Now, what this allows you to do, other than apply the treatment, is, like for instance, in the case of the Bell's palsy patients, initially when we started treating them, we would trace the facial nerves with our probe and get absolutely no reaction from the patients. They are not a fasciculation, I should say. They can feel it. They can tell us the way that it radiates into the nerve, that the sensation is correct, and they feel excited because they feel activity in nerves that they haven't felt for a very long time. But no fasciculation. But after a week of treatment, all of a sudden you see a little twitch, and then you see the nerve coming back on board. A week later, you cannot treat at the highest current anymore because of sensation, the prickly feeling, etc. And you get the same fasciculation at 25 milliamps. And so you've got an objective measure to measure your progress of the patient as well. Obviously, in case of purely sensory nerves, like some facial nerves, you will rely on the feedback of the patient to tell you that, yes, initially 30 milliamps, but after that, when the nerve starts getting better, they'll become intolerable. And they'll tell you, no, that's too high. And you know that you see that as a good thing. Some of the best things about this device, well, let's first look at the benefits of the device. Now, like I hammered on it a little earlier, the nice thing about this is that it's targeted, so you can exactly locate the offending nerve. It assists with the diagnosis, it's non-invasive, no surgical complications, no side effects. And lastly, and most importantly, probably treating the cause as a process of neuroremodeling by way of neuromodulation, as we mentioned initially. One of the best things about it is that it's very cost-effective. The device is actually very inexpensive and extremely simple to use. that's it from my side really this afternoon. I'd like to invite you to come and explore a new era of safe and cost-effective medical treatments with us. Come and visit us at booth number 221. We're very happy to offer treatment to people suffering from different kinds of neuropathy. We've been doing so. Actually, Susan Molina and our other person from Bell Medical. Bell Medical, incidentally, is our local master distributor in the US. And we've got 2 reps here from Bell Medical. Thank you very much for your support. Bill, I don't know where Bill is, but he's also around here. He's a guy dressed in scrubs. So we'd be happy to assist you. I'll be there at the booth for the rest of the day and tomorrow. So if you have any specific questions, we're happy to answer them. And like I mentioned, we're happy to come in and offer treatments to you as well. So thank you very much for the opportunity. Thank you very much again, Dr. Raptor.